Hello, healthcare worker. Welcome to my crash course in donning. Some things to remember is that we also always have to take care of our hands for proper hand hygiene. This includes the proper techniques and knowing when to apply hand hygiene and making our hands ready for hand hygiene. That includes removal of jewelry and fancy nails and long nails. There is also an order to donning and doffing of PPEs. So you will need above wrist nitrile gloves, appropriate hand sanitizer, and a disposable gown and a spotter, of course. Disposable gowns are impermeable at AAMI level 3 or above. Some surgical gowns may look permeable, but they're actually impermeable. You'll also need a disposable apron, a surgical mask, or a N95 respirator, a face shield, or goggles. And sometimes we use disposable caps and disposable shoe covers. However, please do not use a disposable cap for a shoe cover, or if you do, please don't let us see it at all. A chair may come in handy for putting on and removal of shoe covers. Let's get started. You will not need a hazmat suit. Hazardous material suits are for other diseases. You will have disposable gloves and face mask for most procedures. You will also have perhaps shoe covers and head covers. However, our gowns and our face shields are staples as well. So to put on the gown, it's pretty straightforward. You open it out, open side faces you, put in one hand at a time, and please ensure to tie the back so that your colors are not exposed. You can tie this to the back or to the side. There's a little trick. If you tie to the side, it's easier to remove. And doffing comes. And another little trick. If you do not have thumb holders, you just push your thumb through so that the sleeves do not slide down your hand when you're doing whatever you're doing. Pull them down a bit because they get in the way when you're ready to do hand sanitizing. You proceed to put on your face mask, then your face shield as is required, and if you need it, you can put on your disposable cap as well. The final thing to go on is your gloves, and your gloves must be above wrist. If not, you pull them down as far as possible in both sides so they're protected. Now let's go through doffing, which is taking off the PPEs. It's a similar steps, but not the same. Let's start with the gloves. It's easier to pinch near the wrist and use the inside clean side to remove the fallen glove, though you may stick your finger underneath and pull them off and throw them away in a large rim disposable container. And between each step in doffing, it's important to perform hand hygiene, and we can go through hand hygiene in another tutorial. The second step is to remove the gown. As I mentioned before, if you do not have a spotter, if you tie it to the side, it's easier to remove it, to untie from the side. That way you keep yourself from touching the front of the gown, which we consider dirty. That's why it's okay to touch the shoulders, behind the shoulders, where we consider sides or shoulders fairly clean. Remove the gown slowly so as to not agitate anything into the air that may be on the gown, and roll up the gown so that the outside is turned in before disposal in your large rimmed bin. Remember to perform hand hygiene between each step. Remember, when we're performing hand hygiene, there are 7 steps that we must take, which are very important so that we don't neglect any surface area on the hand, and we must allow it to dry for it to work. So we may remove the face shield, first. Remember to dispose of it far from you. Then hand sanitize between each step. Then remove the disposable cap and hand sanitize between each step. Then finally, the face mask. The face mask may be different depending on if you use a surgical mask, N95 respirator, if it goes behind the ear or over the head. Now, if it goes behind the head, one goes at the nape, one goes at the vertex. You want to remove the one from the nape first, then the one from the vertex last. That way, it does not flick back on you when you're taking off the mask. Finally, hand sanitize. And remember, when you're removing the shoe cover, lift from the very clean side and hand sanitize after as well. If there's anything, please click the link in the description for more information. Thank you.